Joining me now is one of our Good Souls honorees, Dr. Nia Imani Bailey. Dr. Bailey is a radiation therapist based in Delaware. Welcome.
Thank you so much for having me.
So for folks who may not know what a radiation therapist does, explain.
We kill cancer. It can be in breast cancer patients, prostate, lung, brain, head and neck, skin. We are killing the cancer, and the goal is the cancer won't return.
So how did you decide to get into the field of radiation therapy?
Curry James Bailey III, my dad, he was diagnosed with prostate cancer when I was a sophomore in high school, and although he kept it from us, when I finally realized that he went through it because I'm a daddy's girl, I had to get in the same field that cured him.
And you wanted to be the cancer killer. Mm-hmm. And so in your practice, there were some red flags when it came to breast cancer specifically. Tell us what those were.
Young women coming in for radiation treatments to the breast. One woman, she was 24 years old, and we looked just alike. We had box braids, the same gold anklet. We both liked a popular Philadelphia rapper, and she passed away at the age of 24 years old. Another woman, Kwania Lopez, that was my girl, and she passed away when she was 42 years old. But it wasn't until Jacqueline Smith, my friend, she came in and we just vibed. I'm with the patients between 4 to 7 weeks, so you really gain a rapport. And before she passed away, she said, "Don't forget about me," and then she passed away. And so that was the red flag, that young women are being diagnosed with breast cancer, but they're passing away too.
Yeah, and the cancer screenings for breast cancer were 50. They recently lowered it to 40. And many of the women you talked about would not even be in that space to even get the screenings. What did you decide to do?
Absolutely. I decided to create a documentary. I said, sometimes people don't like to read books or look at a presentation, but you know what? I love movies, I love documentaries, so that's how we can sort of learn. So I was able to interview 3 phenomenal women.
What did you find? So many young women, did they think that they were susceptible to the disease at their age?
They did not know at all. They didn't know that it could be them, but what they did know is that something was wrong with their body, and they advocated for themselves. Sometimes they had to advocate for months, but they knew to do that. The doctors kept saying, "You're too young for cancer, you're too young," but they kept saying, if there's something called pediatric cancer, then I'm not too young for cancer. And so they really pushed, and unfortunately they were diagnosed.
What do you hope people take from this film?
I hope that we can save lives from this film, that we can talk about family cancer history, advocacy, clinical trials, genetic testing, and knowing your body. That is so important. And I think by doing that, we provide everybody with the resources and tools to save lives.
Dr. Nia Imani Bailey, thank you for all the work that you do. Definitely good soul work. Thanks for being here.
Thank you for having me.